schools and public health agencies definitely are two different cultures. Working across those cultures can seem daunting, particularly if you have your own work and time constraints and your own objectives. But with Healthy People 2020, the objectives are the same for education and health. And so we want to look at some questions to think about as you're approaching schools. Rather than bringing the health agenda to the school and talking about what's most important for you, now's the time to really be able to bring the health agenda to the school and say, we know what's important to health education leaders. We know that these things are important and that together we can work to make changes in the community and to find programs and resources that will meet both of our needs. Look at how schools can support your agenda. There's a big movement in education now to have schools open and available to the community. And so in those cases, those after-school programs and health services that can be provided to the community and the schools may be ways to help meet to achieve the indicators. How can we have a mutually beneficial collaborative strategy, working together? And Claire referred to the Guide for State and Communities, which is a great resource for building community coalitions. And there are a number of those resources out there, some of which are on education websites and some of which are on health websites. But hopefully you can bring those together and really look at mutually beneficial strategies. Next slide, please. So what specifically can you do either as an agency or as an individual in order to start this conversation and to partner together? And these are some effective evidence-based practices that we've worked with in schools and that are highly recommended for you to consider. Every school has a school improvement team. The districts have school improvement teams, and that's a way to be able to work with a school as an individual or as an agency to really help them improve the student achievement rates, the literacy and math rate scores, all of those things that we saw earlier as being important to the health, safety, and well-being of adolescents and young adults. Involve school representatives in the community public health planning. I have been in communities where the school has been seen as separate and apart from that, and it's really helpful to bring them into the process and to work with them closely. And then use your community surveillance data to help school officials figure out what health-related absenteeism is going on, what health risk behaviors are in the community, what kinds of protective factors. Often you can look at that surveillance data to tease out whether absenteeism is because of a health issue or is it a safety issue. And so that's important data for schools to look at to be able to make the changes and select the strategies that are more effective. Next slide, please. Many schools around the country have school health councils at the district level or school-level health teams, again, either as an individual health practitioner, as a health agency representative, or as an individual citizen of that area. You can be part of that school-level health team or district school health council. Often schools don't know what's most effective and are looking for ways to make changes but haven't necessarily done an environmental assessment. And so as a health practitioner, a health agency person, if you could promote the use of some school environment assessments and some of the other tools that are available so that they can make the best choices around what needs to be improved, what is the most effective way to do that improvement. And then support community youth development programs. Next slide, please. These are there are opportunities for service learning that you could also promote. And with all of this work together, we are looking for the same outcomes, students achieving at every level in school, healthier students ready to learn when they arrive at school, and certainly to adopt healthier behaviors that will provide those long-term positive outcomes. Increased graduation rates. If we can increase the graduation rate of our students and their ability to be ready for this century, we're all going to benefit in the long run. And 21st century learning skills include health literacy. And so I know a number of people are concerned about health literacy being pushed to the side by many groups, but that is part of the 21st century learning framework. And we want to see decreases in disparities in education and health, which will happen as we come together to work together. And also, of course, the increased percentage of healthy, productive adults. Next slide, please. I wanted to offer my references for you. If you get the slides, next slide, please. And next slide, please. You can learn more about ASCD's work connecting schools with public health and communities on the Healthy School Communities portion of ASCD.org, and this is the screenshot, and my contact information is at the bottom of the screen. If I can be of any assistance, I would be glad to help you and answer any questions.